Hello, everyone, and welcome back to Women in STEM. My name is Awa Conte, your usual host, and today we're going to talk about something that really matters to every Gambian: healthcare. Now, healthcare is not just about hospitals and medicine, it's really also about women leading the way in clinical research, in improving patient care, and of course, in shaping policies that can literally save lives. And here's the thing: when women are part of the research, the science becomes more complete, the healthcare becomes more inclusive, and the whole nation benefits. Joining me today is someone whose journey perfectly reflects this connection between service, science, and leadership, which is Memuna Jawara. She's a nurse anesthetist. She's a clinical researcher and she currently pursues her PhD in clinical epidemiology. Memuna, welcome to the show and thank you very much for being with us today.
Thank you, Awa. I'm happy to be here with you today.
Thank you so much. Now, today we are talking about healthcare. We're talking about the role of women in healthcare and clinical research. Now, but let's start with your story. How did you first go into healthcare, and what inspired you to take it into, to take it further into clinical research?
Well, to start with, back at high school, I used to be part of a peer health group where we do advocacy, sensitization on malaria and stuff like that. So at some point, I think we had a sort of a complexity at the school back then at Nusrat. And then
Mm-hmm.
we took an approach in addressing malaria by telling people, like, I mean, do you know that malaria normally most of you don't have it? When you are already asleep, most of the time you have it while you are sitting at home. There was one time when I was telling this, my mom was like, "You are a big liar. How is this possible? Because the only time you get bitten by a mosquito is when you are at bed and stuff." Like I said, no. Most of the time, I mean, during rainy seasons, we sat outside chatting, and during these sessions, we got bitten by mosquitoes, and this is where we got malaria. Even after which we are going to sleep on the mosquito net. And then my mom was so amazed. I was like, wow, yes, I think this is really key and we are not aware of it. I think since back then I got this notion. I'm like, okay, wow, I think I can do better. I mean, in the health sector. So this
Mm-hmm.
is how I actually, after my high school, I was not able to get into the health sector immediately. And then I started with computer science back in the Gambia. Then after, soon as I got the Moroccan government scholarship, I came in. I said, okay, this is an opportunity for me. And then
Mm-hmm.
by then also, anesthesia was something that was new to me. When I came, I got oriented by the seniors. They were like, I was like, what is anesthesia? I've never heard of this. I'm like, okay, I think I have this passion to actually make a change. I mean, in the health system, healthcare in general. So I think this is something new, and Gambia, I don't think we have a lot of it, and I think it's going to be impactful when I actually get into this. So that was how I actually got into anesthesia. Then after doing anesthesia, I was still saying to myself, I think there is a lot of unanswered questions. So when it
Mm-hmm.
comes to clinical care, and I mean, from experience I have in Morocco here. So I said, I think it's better to actually get deeper into healthcare and health research. So this is how I got into the masters, and I did my masters. After the masters, I went back home and practiced in the Gambia, and then came back again to pursue a doctorate in the clinical epidemiology.
Wow, so inspiring. Maimuna, thank you very much for sharing that with us. I am quite inspired by your journey. And, it really goes to show how our journeys might not always be linear. So, you started with computer science, and then you
Yeah.
have an opportunity to come to Morocco to study, anesthesia. And it's quite really interesting because it also shows, having talking about your mother and your that chat with her, it shows how personal experiences can also turn into, professional journeys. And I think a lot of young people watching today might actually see themselves in that story. Thank you so much. But now, for someone that's hearing clinical research for the first time, how would you explain it? And why is it so important?
I would say clinical research is investigation. I mean, investigation into the healthcare that has to do with diagnosis, diseases. I mean, like the impact of certain treatments or the outcomes. I mean, an investigation into this is deja clinical research. I'm sorry for using some French
That's okay.
that it's already clinical research. So clinical research is important because I mean it adds on to the knowledge. I mean what is already on the ground, and then it helps also to integrate new innovation, new ideas, new treatments that is going to actually be a plus to our health and the health
Mhm,
system in general.
mhm. Thank you so much. I think that's such a clear way to put it. Research is basically the invisible backbone of healthcare, and people may never see it, but they would feel, the impact every time they visit the hospital. Really. Now, why is it so
Yeah.
crucial to have more women involved in clinical research, especially in the Gambia?
Okay. I'll just start with maybe giving a reference of a report in 2023. That was from State of Women. I mean, in leadership, especially in global health. Actually, like from statistic, 70% of the global health workforce is occupied by women already. Okay,
Okay.
so
Interesting.
when you talk about nursing, 80% of global nurses are women. When you talk about midwives, we talk about 90%. Okay. So looking at this, okay, plus women for a healthy society and a progressing economy, we need healthy women. Okay. So therefore, like it is really important to venture into research, to promote research that has to do with women and involving women.
Hmm.
Because as I said, a healthy women, healthy society, and a progressing economy. So these are key things that should, I think, encourage any nation or country to actually encourage health research, especially women in health research. Because despite that, having said 70% of the global workforce, health workforce is women, yet still only 25% of women are in decision making table. So we are talking about 75% of decision makers in the health sector globally are occupied by women, and yet still women are in the forefront of private healthcare. So it's really important for women to actually come up and to be encouraged to take part in clinical research. This is going to help a long way in actually improving women's health, children's health, and society's health, and a progressing economy, of course.
Interesting. Now, during when you answered the first question, you mentioned that when you went to after your BSc, you went back to the Gambia to to gain some experience, I believe. Now, in your experience, how represented are women in the Gambia's healthcare sector?
Women are well represented in. I mean, I wouldn't say they are well represented when it comes to decision making, but in the primary healthcare, women are in the forefront and they are in the majority. When you look at nurses, women are the majority. When you look at midwives, women are the majority. So I think women should be empowered. Those midwives, those nurses should be empowered through research to be able to embrace new innovations in healthcare, which is going to be an added value to the health system.
Indeed. Now we talk about representations, because but then before before we have nurses, before we have women doctors, we have, first of all, we have girls that we have to be passionate about medicine and medical related areas to get into those things, so that we have more women in the healthcare. What do you think are some of the opportunities and resources that are currently available for young girls in the Gambia, who are still going to school but passionate about healthcare?
From experience, I wouldn't say much about that because I have not seen a lot going on. But
Mm-hmm.
then, from the little experience I've seen places that I've worked from,
Mm-hmm.
encouraging girls that actually want to get into the health sector by encouraging them to allow them to come to the hospitals and volunteer
Mm-hmm.
as a healthcare assisting healthcare professionals. In doing so, this actually help them and give them a practical background and of course some theoretical background in preparing to venture into the journey of healthcare provision. And I think that is something which is really encouraging. Yeah, it's really encouraging because, like, if at all that they those are closed, I mean, it might be discouraging to them to actually get into the health sector, especially also those who are not science students. I have seen people who are not science students, but yet still they have this passion for health. Okay, so I think the Gambia is also doing well by actually trying to embrace these people, even though they take a longer route by maybe taking some courses before they get into the university, some health
Mm-hmm.
courses like biology and chemistry, etc. Okay, for them to actually get into maybe let's say nurse attendant school, for them to start with that. From there they get into the registered nursing school and then they climb the ladder. I've seen people who have actually taken this route and they are doing wonders at our, I mean, in our health care unit. And you hardly even tell, like, if this person was a science student or a non-science student, because I've seen some of those people who are doing far better than people who are from background science students and they are yet still in the health sector. So I think, I mean, the passion to do something, and if a person is encouraged to do so, I think it's a big deal in, I mean, in achieving what we want when it comes to quality healthcare.
Okay, so what you're saying is that students don't necessarily have to graduate from the science stream at high school to be able to, get into healthcare. Hello, Maimuna. Maimuna, can you hear me? Looks like we are losing Maimuna there for a second. But if you're just joining us, this is Women in STEM, brought to you by the Alkamba Times, every Sunday at 5 p.m. GMT. And today we're talking about the role of women in healthcare and clinical research. Maimuna, if you can hear me now.
Yes, I can hear you quite clear.
Yes, please. So you mentioned, you have students that graduate, even without having gone through biology, chemistry, physics, and stuff like that, being in the science stream at high school, is what you're saying that students don't necessarily have to graduate from high school in the science stream to get into healthcare?
That is what I'm trying to say exactly, because like as you said, like it's not always a straight route.
Mm-hmm.
Um, for me, I started with computer science, and I
Mm-hmm.
have found myself in clinical healthcare. You understand?
Exactly.
So
Mm-hmm.
some people don't actually have the opportunity back at high school to do science based on the criteria that have been put in place for science
Mm-hmm.
students, for you to be a science student. But then after, so long as you have this deep desire to care for another person, I mean to
Mm-hmm.
serve in the health sector, you can take another route, and then you will also rate there. It's going to
Mm-hmm.
be a long one, but then you will finally reach there, so long as the determination is there. Because this is not something that I've just heard. I've just seen it firsthand. I've seen people that I was like, wow, seriously? Because if you see them walking, like I mean, providing healthcare, you'll be like, no, like it's not possible that this person is not a science student. And yes, still
Mm-hmm.
that person was not a science student, but because the person has a determination, a strong desire, and a passion to serve in the health sector, and the person is being encouraged also, starting from being a volunteer, doing some courses, then get into a nurse attendant school. From there, you get into a registered nurse school, and then voila, you become something. I mean, someone who is going to, I mean, contribute, I mean, immensely into the quality healthcare delivery.
Indeed, and if you're a girl out there that is watching this, you've had Maimuna. You don't necessarily have to be a science student. I mean, now Maimuna, coming back to everything that you just said, I want to hear what you think about online resources, also online courses that girls especially can take that are passionate about healthcare and being in the medical field. Are there any resources online? Are there any non-conventional learning methods that they can use, maybe courses they can take online or programs or anything?
I mean, like with the internet, I mean, everything is out there. It's just a
Mm-hmm.
matter of you having a proper direction as to how to use it. But they are all out there. We have, I mean, free courses, I mean, preliminary courses that you can take
Mm-hmm.
before you get there, as you get there. So they're all out there. So it's just the determination and a proper direction as to how to go about it or to fetch out those resources that are already out there. But they are there always. But then a person who is not even aware of the existence of these resources, then it becomes difficult for this person to actually make good use of it.
Exactly, and that brings me back to exposure. Having girls having exposure or having mentors that are going to actually guide them in journeys like this, because sometimes it's not that the information is there. It's that you are not even aware that the information is there. So, do you think that mentors, women mentors or role models like yourselves are also very important for young girls that what to get into the medical field or any area in STEM for that matter?
Sure, sure. Like me for me, I always like sessions whereby like talk about things. Okay, this is how we can improve this and this. I like those kind of talks, you know. So I
Mhm.
mean, I think in the Gambia, like I think we need more mentors when it comes to clinical researches, especially women. But because historically, I mean, even up to date, like women are not too much into research. I mean, when
Mhm.
you look into statistics, you find out there are more men are more empowered than women. So I think women should be more empowered. Like, I mean, we should have mentors, and the policies should also be put in place to actually encourage women to venture into research.
Indeed. Now, Memuna, you as a woman healthcare professional, what do you think are some of the challenges that Gambian women in healthcare really face? And personally, how do you overcome them, and how do you recommend that other people, other women like you, overcome them?
Okay. When you talk about the challenges, like we have structural challenges.
Mhm.
Okay, we have societal. Okay, so when you talk about structural challenges, we all know there is. I mean, the men are termed as. I think would I say powerful when it comes to the roles and being leaders, being in decision making than
Mhm.
women. That is like even when you when it like institutional at institutional level, that is how it is. Okay, when you look at the health system, you look at the institutions, you study it yourself, you realize that is the trend. Okay, and then also social wise, women are stereotyped, of course, like okay, we should men should be more specialists, they should be doing this big stuff, and the
Mhm.
women should just be doing the minor care, and then they should limit themselves to that.
Mhm.
Even if you are someone who has a passion to actually go further, most of the time, because like you are a woman, you're like, oh, you are a woman, what are you doing there? I mean, okay. So I think those kind of mentalities are really challenges when it comes to in our systems that I've actually got a little bit of experience of. So I think those cultures and challenges, I mean, should be something which should be addressed, because without it, it's going to be difficult for women to actually climb the ladder, and then I mean overcome the barriers getting into clinical researches, and obviously and finally in the decision making table.
Indeed. Mumina, how does it feel to be a PhD candidate, a woman PhD candidate in you mentioned how men are perceived to be, the people that uh, I would not say qualified or powerful, but you know what I mean. It's men that get into these areas. It's men that go up to PhD level in something like research, in something like clinical epidemiology. It's crazy. How does it feel to be a woman in a field like this, studying up to PhD in a field that was perceived to be for men?
Well, I think it's I would say I would say it's like I think is it's amazing, and I would say it was a challenge also, like because before you reach at this level, a lot of challenges, I mean, were on the way, but then with perseverance, of course, discipline and determination, and you finally got there. So when you finally get there, you are like, okay, wow, okay, I think this is inspiring. And then you are also encouraged to actually mentor other female,
Mhm.
especially in the science field, who actually want to climb the ladder, get into
Mhm.
clinical research, get into higher studies when it comes to health. And
Mhm.
I think this is really amazing, because I think now all I want is to actually talk to more fellow girls out there who are in the health
Mhm.
sector, and then they they are really inspired to go further. So to talk to them and then lead the way.
I see how
Yeah.
eager you really are to help other girls and women get to where you are. Now, have you had this as someone before you got to where you are right now? As a student, as a BSc candidate, as a BSc student in Morocco, have you had mentors? Have you had someone to look up to and to guide you in this journey? Has that
Yeah.
happened for you?
Yes, yes, yeah, yeah. I got some few mentors that were actually doing anesthesia back then. We have Teresa Mate Fatsila. Those were the two Gambians who were here in Rabat doing anesthesia. Then they actually helped me a lot. They oriented me, actually gave me some heads up and stuff like that. And then that actually helped me a long way throughout my journey during the BSc. Yeah, I'm really grateful.
Indeed, I think anyone out there, any woman, any girl out there will relate to that. I think mentors really go a long way, not only in healthcare but every sector in STEM. Science, you talk about science, you talk about technology, you talk about engineering, mathematics. Support systems are very helpful, and
I
that
agree.
is
Yeah.
why personally I am very grateful to Women in STEM Gambia. Having women supporting women, it's quite something that should be should not be taken lightly, because I realized personally, I'm talking about from personal experience. Before I knew about women in STEM Gambia, I was on my own, doing what I think is best for my journey. But having meeting Anticodu, the president, and other women each other, is it was mind blowing for me. It was
Yeah.
really great,
It's
and
really
I
good to
find
have
out that
mentors.
having support systems like this are very important. Exactly. So if you're a girl out there that is watching, don't limit yourself. Don't sit in your corner. Don't isolate yourself. Reach out to people. Find these support groups. And women in STEM is very. It's not something that is not known. It's very known. And then so if you're a girl, you're studying, you're passionate about STEM, you can join the movement. You can join the platform, and you're going to have women mentors that are going to guide you. You're going to be inspired to do even more than they're doing. We've seen what women are doing in STEM in Gambia, and like I said, support groups are very, very important. They go a long way. Now, Maimuna, from your perspective, how can let's bring it home back to Gambia. How do you think STEM education in general can help strengthen our healthcare and even contribute to national development?
I mean, I think it's really crucial because, like, I mean, women in science, obviously, technology. I mean, for any advancing nation, like, there should be a progress in technology. So, if we have a lot of women in science and technology, already that is a plus to actually mentor the upcoming generation
Mm-hmm.
to be big people tomorrow. I mean, in the science and technology, which is going to be an added value to the development of the country. So it's really it's something which is really, because back then, I mean, back then our parents or maybe our grandparents, they did not have this opportunity. Okay, they did
Mm-hmm.
not have this opportunity. Some of them, like, I mean, they go through a lot. I mean, their journeys are full of, if they had a guidance, I mean,
Mm-hmm.
mentors like we have today, it would have been different today. They would have been at a different level today. So since we got this STEM, I think Gambians, we should make good use of it. I mean, for a better Gambia.
Okay, let's switch a little back to research. How has your nursing background shaped the way you approach scientific research?
Okay. I would say from practical aspect, back then at when I was doing my BSc here in Morocco, we do a lot of practicals. I mean,
Mm-hmm.
in blood operation, ICU, and in operating theater. So
Mm-hmm.
I think I have seen a lot of stuff's going on. I would say misconducts. I mean, a wrong way of doing a lot of things. I mean,
Mm-hmm.
that I just said to myself, sometimes myself, I think from experience, I did
Mm-hmm.
stuff back then. Okay, I did them not because I wanted to, but because I was told to.
Mm-hmm.
You understand? And then at that point in time, I got no evidence. Neither do I have a higher or a higher research. I mean, knowledge, or maybe I mean, read into the literature to know that, okay, this person, what this person is telling me is wrong or it's not. I have nothing to defend myself. Therefore, what I did was, okay, I've been told to do this, I did it, and which was wrong. And
Mm-hmm.
I've been seeing stuffs going on like that. I mean, between us and our superiors, and then even among us as colleagues. So
Mm-hmm.
seeing all this going on, I was like, I think, I don't know for any other person, but for me, I need to read. I need to
Mm-hmm.
read. I need to research. Okay, because there is a lot of unanswered questions that I need to be answered. So I think that was one reason that that encouraged me to actually got into masters. And as I got into the masters, obviously is an introduction to research and all. So
Mm-hmm.
having all those experience back then when I was doing my clinicals actually helped me in actually I mean starting my research as a nurse, as a health practitioner. So it really helped a long way. I mean, throughout. Yeah, because whatever you came across as you're reading into the literature, or you came across something, an innovation, you are like, oh my God, okay, I've seen this, and I mean, it could have been done this, and voila, it's a good feeling, but it was helpful also. Yeah, it was
Exactly.
really helpful. Yeah,
I think research is really, really important because, okay, without research, there are a lot of things that we wouldn't know today. It's not just STEM. It's not just medicine. It's not just in it's not just in technology. It's about basically everything. The more you make research, the more you improve, the more you know about things, and the better and
yeah,
safer ways that we are able to, especially in the medicine, it's quite delicate, and it's important to really find the best and safest ways to treat illnesses, raise
exactly.
awareness about stuff like that.
It's really important because when we talk about research, we talk about evidence base. We talk about
Mm-hmm.
evidence. Okay, either is the improvement on the ongoing practice that
Mm-hmm.
is being done at the hospital level, or the treatment that have been given, or the outcome of certain treatments. So through
Exactly.
research, you are able to actually look into this and to improve for the better healthcare provision. So I think research should be something which should be a norm. It should not be like, okay, like it should not be uncommon. I mean, okay, sort of weird, or I think it should be something that should be a norm. Like everybody, like even if you are not officially into research, as you are practicing as a healthcare practitioner, you should be able to actually read scientific papers, new innovation to actually improve your practice, and also to give a quality, I mean, healthcare provision to people. I think it's really important. But then, unfortunately, hardly do we actually say, okay, I've been working for a few months. Okay, I think I came across this, or I've made this error, or this thing has been going on at my unit or my service. Let me
Mm-hmm.
actually get out there, look at scientific articles that are talking about this particular event, if at all that is infection, or something of such. Let me read about this, and then I will get an idea. Okay, it should be this should be the cause of it. So okay, let me upgrade as I practice, let me upgrade and do it. So these are some of the things, that small things, and they are also research. You are not It
Mm-hmm.
doesn't always have to mean that, okay, you have to be doing a PhD, or you have to be doing some. It's start from, I mean, taking your phone, I mean, looking into, I mean, scientific sites with evidence based on specific topics that are related to your field, or your area of work. Read and then know, okay, this is what is going on, these are the innovations, and maybe these are some of the things that we are doing, and I don't think they are they are appropriate. So this is how you upgrade, and a collection of these is what actually lead to a quality healthcare delivery. But without it, we only stick to what we have been doing for ages, and
Mm-hmm.
which might not always work on every person. So I think research should be something that we should all be doing, regardless of wherever you are, regardless of where you are. Either you are maybe going to school or working, like we should all be doing research. Yeah, we should all be doing research.
Indeed. Now, in fact, talking about research, in your opinion, what is the biggest gap in the Gambia's healthcare research right now?
Okay. First of all, I think I will just take my domain as an example. Okay,
Mm-hmm.
neonatal health. Okay, so in the Gambia, we are among the the highest. I mean, when it comes to neonatal mortality. Okay, yet still, when you look into the literature, okay, you hardly find a paper that is talking about neonatal mortality or maybe evidence-based research that are being conducted to address issues. Example, we talk about prematurity. You look into other countries, you see tons of research works. Even in Morocco, you see tons of research. Even some East African countries are coming up. But then check into the Gambia, you will you might come across a paper, just a paper, one paper, one published paper that is like maybe 5 years ago. So
Mm-hmm.
meaning we are not progressing in that line. So meaning we are not actually trying to investigate into this particular event to actually be able to have new scientific evidence to address them, which is really sad. I think it should be one of the first steps in addressing such health issues. Example, when you talk about neonatal mortality, you talk about prematurity. A lot of challenges have been faced by women in the Gambia. Children that have been born premature, they died. Okay, like due to maybe lack of awareness, lack of quality healthcare, lack of resources.
Mm-hmm.
Okay, so I think compared to other countries, especially the developed countries, okay, so despite there's this difference, yet still in the Gambia, like you wouldn't find a lot of studies being conducted, and without studies, it will always be hard because, like, I mean, even though there are studies, scientific studies that have been conducted into these specific areas, example prematurity, but then when you look at those papers, okay, US, Europe, and then Americas, etc. So most of the time, like the results or the outcome of those research, it's hard to actually implement it in the Gambian context because of our difference in our in our social settings or be our social economic development. So I think it's always it's always the best to actually conduct research in your country that will be aligned with the reality of uh, what is happening in your country. I'm not sure if you are if you are getting what I'm trying to say. So I think there is a big gap when it comes to research in such in the Gambia, which should be, I mean, it's sad and it should be looked into actually by encouraging, of course, more women to get into clinical research.
Encouraging more women into clinical research. But what do you think should be the role of the government in providing, improving and providing more research opportunities, especially for women in healthcare?
Thank you for that question. I think one key, role the government can play is actually to fund researchers. Okay, to fund researchers. Okay, also to provide time for healthcare providers who are really interested into research, because without that it's going to be hard to actually venture into it, whereby your work time wouldn't allow you to actually do any other thing apart from what you do. Okay, so I think the work time should be flexible enough for those people who want to venture into research, alongside also funding them. Okay, and also putting in initiative to actually invite other countries or other African countries that have joint issues. Okay, I think this is going to go a long way in actually encouraging healthcare providers that actually want to get into research.
Indeed. Thank you very much for sharing that. And I think this is a problem that researchers are facing. Not just women. Funding is always a problem. And if people have more access to funding, I think there are a lot of eager researchers, a lot of eager women researchers in the Gambia that are eager to do research on a lot of things. And sadly, funding is always a problem. But now, say with the limited funding opportunities, what do you think these women can really do? What efforts can they take? What initiatives can they take upon themselves? We know the funding issue is always a problem, but what alternatives are there? Say, okay, you want to do this research and there is no funding. What do you think someone can do in a situation like that?
Without funding is always really difficult, but I believe in one thing. Like, despite that you don't have funding, that shouldn't stop you from actually keep learning, from actually keep researching, because
Mm-hmm.
it is as if you are preparing for an opportunity which might come at any given point in time, be it
Exactly.
in Gambia or outside Gambia. So I
Mm-hmm.
think one thing that I have to say to them is actually continue to work, because as you prepare for opportunities by reading, researching, like when opportunities come, you just grab it. You just grab it, like you don't compete with anyone else. So I think and opportunities can come at any given moment, so we just have to be prepared for those opportunities, even though there is not much out there right now. But I think we have to imagine things not as opportunities or things not as they are today, but as
Mm-hmm.
they could be tomorrow. Let's say, like, okay, you have passion for research, okay, you want to do this, but there is no funding. But okay, just envision that, okay, like, as I continue to work on this project, okay, in 2 or 3 years time, what is going to be the outcome? How does it going to look like? And it's like, it's obviously it's going to come, because it's something that you are doing progressively. As you go step by step, later on you find out that you come out with something which is really amazing. Okay, so I think we have to just imagine, we don't have to imagine things as they are today, but like as they would be tomorrow. And then obviously, we are hopeful that things are not going to remain the same. Okay, things are going to
Mm-hmm.
improve. So we have to prepare for those opportunities that are going to come in the future. Yeah.
Exactly, and in fact, one point that I wanted to add to that, if, for example, there's very limited funding opportunities in Gambia, but I think if one wants to get into a research that is as as important as and as impactful as one envisions is to be, I think there are other funding opportunities out there. I think we don't really have to only limit ourselves to the Gambian context. Sometimes
Exactly,
we've seen people win research
exactly. Yeah.
proposals in programs that are not even in the Gambia, in programs abroad. We've seen research competitions here and there. What do you think about that?
I think you've mentioned something that someone, just before I came to Morocco,
Mm-hmm.
okay, there is this mentor of mine, okay, who, I think the day I was supposed to come, we had a short conversation. So, like, he was like, Maimuna, like, one thing I would have to advise you is, like, when you go out there,
Mm-hmm.
don't don't study based on the Gambian level.
Mm-hmm.
Okay, study at an international level. Okay, so I think that actually helped me a long way, because when I came, I realized, okay, anesthesia was, there were a lot of common fields that I could have done, but like, anesthesia was something that's not common in the Gambia. But I was like, okay, I think this is an opportunity. So this is how I
Mm-hmm.
started. So after my BSc also, I was like, okay, I'm not going to limit myself. Maybe, okay, do a normal trend, doing being a nurse. You do your nursing, and then go to practice. You practice for 10 years or no. I want to acquire knowledge as I go along the way. I want to be impactful. So therefore, I expand my network, with other people that are non-Gambians. And in networking with those people, it actually helped me a long way in getting where I am today. So I think it's really important to network, I mean, outside Gambia at international level, there is a lot of opportunities out there. But if you don't network, it will be hard to actually, um, uh, yeah.
I think you mentioned quite an important um, point. In fact, even in the tech field, sometimes people tell you that like you don't just go and learn because okay, you are limiting yourself to okay. For example, you want to do maybe robotics or you want to do something like cybersecurity, and you're like, okay, these fields are not very common in Gambia. If I go back to Gambia, what am I going to do? I'm not going to have a job in that. But
Exactly.
if everybody says that, if everybody says, okay, I'm not going to do this because it's not common in Gambia, I don't think it will ever be common in Gambia. You
Thank
know,
you.
if
That is it.
you do
That is
not
it.
take
And one
steps
day,
and
if we should
go
have
ahead.
a opportunity for us to have maybe big invention, like, and there is nobody actually who did this. I mean, where are we going? We are going nowhere. But I
Exactly.
think if Gambians are not limiting themselves to what is in the Gambia, I
Mhm,
think when opportunities come, as I said, we are going to be ready for it, and it's
mhm.
going to be amazing.
Indeed. Now, Memona, I want to believe that you've been a mentor to many students. What do you tell young women who feel discouraged by all the challenges ahead, you know, in healthcare, in medicine, in basically every area of STEM? You know, we talked about, you know, lack of funding. We talked about the fact that women are not very well represented in fields like this. What do you tell women and young girls who are perhaps discouraged about the journey?
Well, me, one thing I always address first is like discipline.
Mm-hmm.
We have to be disciplined. We have to be persistent as well. Okay, and we have to be spiritual because I think this is these are some of the three things that actually help me from when I start from my bachelor's up to where I am right now. Because with discipline, with perseverance, consistency, with spirituality, like
Mm-hmm.
any challenge that come your way, you tackle it.
Mm-hmm.
That is it. You tackle it. But without those, it's hard. It's always easy to be carried away or to be
Mm-hmm.
stopped by certain outside forces. But with
Mm-hmm.
this, and it helps. It helps a lot. It helps because like you, when you are disciplined, you have patience also. And when you have patience, a lot of stuffs come your way. You cry and then be like, okay, Safi, let's go. What else? This is how you get there. This is how we
Mm-hmm.
get there. Because obviously you will cry along the way. You will have obstacles. You will be put down by people. But then
Mm-hmm.
with discipline, with perseverance, persistency, with spirituality, you pray to God for God's guidance. And then this is it. You are put on the straight path. And then with this, it is always hard, but then you finally get there. So me, that is what I basically tell. I mean, all my mentees. I mean, aside from other stuff, this is something like is important to me from experience, and I try to pass on to all of them.
Mm-hmm.
Yeah.
Yes, and I really hope that you know, every young woman, every girl that is watching right now, write this down because these words are coming from someone who is a living proof of of the fact that this is possible, of the fact that women can do this, of the fact that women are not supposed to limit themselves and say, okay, this area is for women. You know, healthcare is cannot just be for men because women go to the hospital. Sometimes women go to the hospitals and they really need to be taken care of by women. But sometimes, unfortunately, you know, you are a woman, you go to the hospital, and then you it's not about preference. This is something that you need. You sometimes you cannot, you don't really have that kind of connection or trust that you might have for women to share with male doctors or male
Yeah,
nurses.
yeah.
This is something that is very important. And Memona here is a living proof that women can do it. Women can go into healthcare, women can go into research, and women can definitely earn PhD in research. Thank you very much, Memona, for such an inspiring conversation. We do
Thank
not
you,
have
Awa.
that much time left, but you've definitely reminded us that women in healthcare and research are not just there for the names or mere professionals. They are definitely nation builders. But before you go, I want you to just say your final words to any girl or young woman that is watching you right now.
Okay, I think okay, what I would say to any girl or young woman that is out there is like, okay, believe in yourself, okay, be disciplined, be consistent in what you do, and be spiritual. Yeah. With that, I think you will overcome any obstacle that come your way in achieving what you want to achieve, especially when you are in the field of science, because it's always challenging as a lady in the field of science. Yeah, we have families to take care of. We have family obligations. I know choices out there compared to, I mean, our opposite sex. So with all this, it takes all this that I've mentioned actually to overcome them and get where I want to get to. So I think it's really important.
But remember, you've mentioned spirituality a lot. Now I can understand, the perseverance, the discipline. But maybe you might want to explain a little bit how how spirituality actually um, comes into
Oh,
play in something like
okay. Spirituality, like I think it's subjective. I would say, like I mean, I think we all have to build up that connection with God.
that. Hmm.
Okay,
Hmm.
we all have to build that connection with God, and then with that connection, and you have guidance, and you have that kind of force, internal force that actually help you to push, because you know that okay, God is not going to see me going through this, you understand,
Hmm.
because he knows I've been doing this and this and this. So with
Hmm.
this feeling, you always fancy, you always go forward. So I think is really important, and with the same spirituality also, it helps you to actually I mean, foster your discipline, be consistent, and also it protects you also along the way, because I mean, like it's hard to explain because like it's subjective, I would say, but I think this is what I can say. Like, build your connection with God. If you do, I think you get the experience. You will experience it yourself. They said experience is the best teacher. That is
Indeed.
really something, yeah, that actually helped me a lot, and I will advise anyone out there to try. Yes, yeah.
Indeed. I think Memona is a spiritual person. So if you,
Yeah, I'm
but that has helped her a lot. So if you're a girl watching, then you need to see if you think being spiritual is going to help you. But yeah, definitely discipline and perseverance, and of course spirituality, as Maimuna said. Maimuna, thank you so much for talking to us today. Thank you so much for sharing your story. Thank you for showing us that women can lead in healthcare, they can lead in research, and this has been a very refreshing discussion. Thank you so much.
Thank
Bye bye.
you. Thank you.
And now, to every girl that is watching this show, your dreams are not really too big for the Gambia. We need your ideas in the lab. We need your steady hands in the operating room. We need your voice in the boardrooms and your courage in the field of healthcare and every STEM sector for that matter. Because when you're a woman in STEM, when you are a woman in STEM, you do not rise alone. You carry families, you carry communities, you carry the entire nation forward. So let's keep building, let's keep learning, and let's proving the future of science in the Gambia is female. Now, I'll see you again next week right here on the Alkamba Times on Women in STEM. Until then, keep breaking barriers and never stop. Good evening and have a good rest of the day. Thank you very much.